Bacteria are classified as gram-positive or gram-negative based on their ability to hold the gram stain. Gram-negative bacteria do not retain the primary stain and thus appear red when viewed under the microscope. Shigella belongs to the gram-negative rod-shaped bacteria and it can survive with or without oxygen. It does not have flagella and so it's not motile. There are 4 species of Shigella. All these species cause infection called as shigellosis, which is a contagious infection of the intestine, particularly the colon. Shigella is transmitted indirectly through contaminated food, infected food handlers, or from drinking water or from swimming pool. It can also be transmitted from person to person via fecal-oral route. Once ingested, the bacteria survives the gastric environment of the stomach, multiplies in the small intestine, and moves to the large intestine. There, they attach and penetrate the epithelial layer of the intestinal mucosa. They multiply intracellularly and spread, resulting in tissue destruction, ulceration of the colonic mucosa, and subsequent leakage of the blood and mucus into the intestinal lumen. Hence, patients suffering from Shigella infection frequently passes dysenteric stool mixed with blood and mucus. Due to infection, the absorption of water by the colon is inhibited. Illness begins 1 to 2 days after exposure with the symptoms, lasting 5 to 7 days. Severity of the disease varies according to the species. For diagnosis, stool specimen and rectal swabs are cultured. There is no vaccination for Shigella. The best defense against shigellosis is through frequent hand washing, strict adherence to standard food and water safety precautions. Treatment includes rest, intake of fluid, and in severe cases, antibiotics are used to treat the infection.